Let us study the pathophysiology behind pneumonia. Pneumonia is when you have an infection of the lung, but remember, it's not just the organism that is required, it is also the host response which determines what happens in an infection. Typically, the organism's entry happens through microaerosols which reach the alveoli. Now, in most of us cases, the alveoli would be able to take care of the organism. But in a patient who is, let's say, smoker, who has a compromised immune system, patient who is an elderly person, the bacteria would be able to breach the primary defense and reach the alveolar macrophages. Now, when the macrophages encounter the organism, they would release cytokines. Important cytokines among them are the tumor necrosis factor and interleukins like interleukin 1 and interleukin 8. Now, there would be two responses that we expect when a patient has pneumonia. The first response is what is known as the local response. This is what happens in the lung. There would be an infiltrate by neutrophils, there would be a damage to the epithelial cells, and of course there would be RBCs coming out into the alveolar tissue. This together is going to be jam-packed within the alveolar tissue, and that is what leads to what is known as consolidation. So for a clinician, what is pneumonia? For a pathologist is what is consolidation. Now, the macrophage leading to these cytokines is not only going to have a local effect, it is also going to have a systemic effect. The systemic response is what will lead to fever. The systemic response is what will also be seen as a patient having an increased respiratory rate, sometimes having an altered sensorium, and in dangerous scenarios, a drop in the blood pressure. These three can be assessed by the quick SOFA score, and presence of this tells you that the patient is heading towards or is already in what is known as sepsis. That means there is a systemic response due to an infection. A patient with sepsis would deteriorate towards a multi-organ dysfunction syndrome, increasing the risk of death. So from here, I hope you understand that when we think of pneumonia, we are not just looking at a local problem, we could also be looking at its systemic problems, and that very often is a bigger cause of concern. I hope you remember this the next time you see a case of infections like pneumonia.